two of these. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the care you trust. And you have joined Ask a Care Navigator, Mondays with Maureen. We try to create these on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. And today is our first session going live to both Facebook Live and YouTube at the same time. And I want to thank my colleague Heidi in our marketing department for setting this up. Today we're going to be doing a show and tell, so that's why this bag is here. If you have any questions or comments, you can call us at 866-466-9734. Or you can go to our website, which is fourseasonscare.org. Be sure to spell out the number 4. We'll be glad to share information with you. Today's session is called Preparing for the Unexpected, which I in my role, I spend a lot of time talking to people about planning for the unexpected, for the what ifs. But in this case, it's preparing for the unexpected, a trip to the emergency room. None of us wants to do that, but maybe some careful planning will help you should this happen to you, particularly if you live alone. I was working with a client some years ago in her mid-90s, and she said, Maureen, help me create this to-go bag. And so actually there's a lot of lists out there, to-go bags for people going to the emergency room. So this is what we came up with. So I want to do a quick demonstration of this for you. And know that if you want a copy of this list, just send us a message either here in the chat, but you may not want your email to be public. You can go to our website, that fourseasonscare.org, and I'll be glad to send you a whole list that I use of items that people have advised that this is a good thing to take for an emergency room trip. And what you plan to do is craft this to-go bag and just leave it in the closet. It just stays there. There's only a couple of things you add to it when you're ready to go. So let's have a little demonstration. First of all, just pick a bag. I picked one that I don't use often, and it's kind of colorful, hard to miss if it's just sitting in a closet. And one of the first things you want to put in here is a change of clothing. I have a t-shirt and some tights here, just something that should you get to the emergency room, and of course you have to take all your clothes off, or your clothes are soiled for whatever reason, you're going to want something clean, to put something on clean. Here's a change of clothing. And in fact, I think it's a really good idea to put that change of clothing in a plastic bag. Now I use this big Ziploc bag so you can see what's in there. So you can just put it in a grocery bag if you want, but some sort of plastic bag, because suppose the clothes that you're wearing right now get soiled from whatever reason. Now you have a plastic bag to take them home in. Okay, so just have it right there. And if you're someone who, you can also put a change of underwear in here, or if you're someone who wears disposable undergarments, either male or female, you'll want to put an extra one of those in here, because frequently emergency departments do not have those available to you. So put your clothing, any undergarments, including your undergarments, into your go bag, your emergency go bag. And I like to just put them all in a big plastic bag like this, because the plastic bag might be used for anything that's soiled when you come home. So put that in your go bag. You'll also want to have some hand sanitizer or moist wipes. I forgot to put those here. We got the plastic bag, and it also says just sometimes you can bring a reassuring comfort item. So if you have something like that, a rabbit's foot, a Lucky Charm, you can toss that in here too. The one thing that won't be packed in your go bag and ready to go is your cell phone. You will want to take your cell phone if you are a user and put it in here with you when you're going out the door. Or, if the emergency medical providers come in, you're going to say, look, I want you to look in that closet and pick up that bag, and you're going to want to have your cell phone and put it in there with you, okay? Along with your phone chargers. Some people keep extra phone chargers in there along with the AC adapter, because you can't count on just being able to plug a USB or something into a spot in the emergency room, but you'll want to have a phone charger. Very important. So your phone and a charger, you're going to want to grab and drop in there. And inside your cell phone, you're going to want at least one ICE in case of emergency contact. It may be, and you can label it as such, in case of emergency, because quite honestly, there are ways to get to those contacts by emergency providers without knowing your passwords, but that's for another session. But you do want to have at least one, preferably more than one, in case of emergency contact in your phone that can be quickly accessed from the front screen. I'm trying to get mine to show up. There we go. There's an emergency medical information on my cell phone right here in the middle. Okay. That way, emergency medical services providers can access your in case of emergency, your ICE contact. All right. Now, because I didn't want to list all of my information for you, you also want to have a list of your allergies and your medications. It's very helpful, by the way. There's a way to include that in your phone, medical emergency information. But once you get to the, excuse me, the emergency room, excuse me, many people are too frazzled to remember what my allergies are, what my medications are. Not write them all down, all your allergies and all of your medications. And if you don't mind, not just your medications, but any supplements or vitamins or minerals that you take. List it all and how often you take them. Okay. So just put that on. You can make that its own piece of paper, or this can all be in one document. So you're going to put a list of your allergies and medications in there. You want to have a document that also includes the contact information for any physicians, nurse practitioners, or physician's assistants, any providers whom you see. So I see Dr. John Smith, located at 123 Main Street in Asheville, North Carolina, and the phone number is 828-555-1212, whatever the phone number is. You can make all of this, like I said, in one list, but please have documentation that says who are your providers and how to reach them. You want to have a list on your list of key family members and their contact information. Perhaps if you live alone, you want to have the name of your sisters or your brothers or your adult children or your parents, for that matter, or good friends, but that's coming. But any close family members that need to be notified that's where you are, key family members. Also on that list, you might want to list a faith community leader. I've mentioned many times that my husband is a pastor, and frequently he is called from an emergency room by either the person, the patient, or a family member, or even the emergency room staff have called him. So if that's of importance to you, list the name and contact information for your faith community leader. Put that in your bag. And finally, I mentioned helpful friends. Maybe some lists of helpful friends, your close by neighbors, people that might have a key to your home or your apartment that can go in and get things on your behalf. But have that listed there, because if you're solo in the world, and there are many solo agers out there, you might have to rely on helpful friends to help you in these circumstances. Put that contact information into your to-go bag. So we've got a list that's generated now in our to-go bag. Okay. Now, those can be original documents. The following things, for the most part, you will only want to put copies of these. Let me just say this. Do not bring your wallet. Do not bring your purse. Do not bring your wallet that's inside your purse. Don't do it. Just don't do it. But what you do want to bring with you is a copy of your driver's license. This is a sample North Carolina driver's license. I just pulled that off the web. So you do want to have a copy of your driver's license. Put that in there. And it might be helpful to put all of these copies of things in a plastic sleeve or a folder. But put a copy of your driver's license there. You'll want to put a copy of your health insurance card, and not just the card, but what's on the back of the card, the prior authorization information, and what phone numbers to call or what website to go to. Very important, not just the front copy side, but the back side of your health insurance card. Very important, okay? So put copies, not originals. Put copies in your go bag. If you are Medicare or Medicaid recipient, you will want to have a copy of your Medicare card. It's usually red, white, and blue. My printer wasn't cooperating today, and this is just a sample. Your red, white, and blue Medicare card, a copy of it. See, it doesn't have to be red, white, and blue. A copy of your Medicare card. People will be looking for that. Put a copy of that in your go bag. And if you're a Medicaid recipient here in North Carolina or anywhere else, you will want to have a copy, not an original, of your Medicaid card. Okay? It's very important. You might also have a plastic card for quick purchases as part of your Medicaid plan, but at least have a card, and the print is so fine. But that lists your name and your Medicaid number if you are a Medicaid recipient. So that was just a whole lot of health insurance information, wasn't it? Copies of those. Don't put originals. The other copies you will want to have is a copy of your advance directive for healthcare in the state of North Carolina, if you live here, or anywhere you live for that matter. You want to have an active copy, a copy. Don't bring your original of your healthcare power of attorney. Now, related to that, you might also, if you have one of these, you might want to have a 5 wishes. Again, a copy. If you have 5 wishes, make a copy of it. Now, this is 12 pages long or 11 pages long. So you want to have copies of this. And your 5 wishes are really like a living will. Okay. So that's a bit more about healthcare. Put a copy of that into your go bag. And then I would really encourage you, you may not need this, but you just might, a copy of your durable power of attorney. This is a North Carolina statutory short form for power of attorney. There are various documents. If you have done your advanced directives work, you have this. You may have done it with an attorney or done it online for yourself, but it's good to have a copy of your durable power of attorney. That's the document that basically someone can step into your business decisions on your behalf. You want a copy of that in your bag, okay? Now, of all the things I want to show you now that I've shown you that you don't want to have a copy of are these 2 documents. If you have a do not resuscitate order, if that's what you have in your life, you want to bring an original with you. Now, many people just have these tacked onto their refrigerators or their bedroom doors. You can have more than one of these. And my clients who create these go bags, they talk to their physicians and they'll say, I want another one. So I keep one in my house, like on the refrigerator or bedroom door or whatever, and I want one in my go bag. In fact, I know some people that keep one of these originals, they have to be originals, in their glove boxes of their cars. But you can have one ready to go in your go bag. And for this one, it has to be an original. Okay. So if you have a do not resuscitate order for yourself, put it in, and that you have an extra one of. Again, you're just going to put this, except for your phone, you're going to put it in your closet and leave it there ready to go. Okay. And the other thing you can have only an original of is a most form, which is in the state of North Carolina. It's the medical orders for scope of treatment form. It has to be this Pepto-Bismol pink color form. And it's the form that goes over your medical orders for scope of treatment in the realm of resuscitation, extent of medical interventions in terms of going to the hospital or not, IV antibiotics, IV fluids and hydration, and feeding tubes. So this is what it's called and looks like in North Carolina. It has other names and acronyms in other states. Each state is different. But no matter what, you have to have an original. You cannot bring a copy of this form or your DNR for them to be effective in the state of North Carolina. Okay? The goldenrod or the pink form. So again, this is something you get from your physicians. It's my way of saying, I like to say, it's your way of telling the doctor what to do, which is fair. These are medical orders. They have to be honored because you initiated them. All right? So if you're going to have these, have extras of these, not copies, have extra originals and put them in your go bag. The only other thing you might want to keep in there, some people have told me they like to have some water in their bag, some water to go, but also you're going to want to have some toiletries. And let me really advise you on this one. I encourage you to get like a travel size of deodorant, just maybe a sample of dental floss. Yeah, or I've got regular dental floss, a travel size of toothpaste, and a toothbrush, just a brand new toothbrush. You get them from the dentist every 6 months. You can get another. Put those in a Ziploc or brand new one and just zip it up and leave it in your go bag. It's just going to sit there because oral hygiene is so important, as well as deodorant. But these make us feel more real, don't they? Just those are the kind of the basic toiletries to bring. Ladies, don't bring all your makeup. Men, don't bring all your shaving kit stuff. just the basics. And believe me, I just learned this weekend how important it is to have good oral hygiene if you wind up in the emergency room of the hospital for extended periods of time. You can avoid hospital-acquired pneumonia by having good oral hygiene. Fascinating piece of information. But aside from that, just have some toiletries with you. And a final thing that people encourage is you can just have a little Ziploc bag full of coins or maybe a couple of dollars, not a lot, in case somebody need to send someone to the vending machine to buy you a snack or something, if that's permitted. So just a little Ziploc with some coins, or just no more than about $2 or $3. Trust me, don't bring a lot of money. So this is a go bag. Oh, the only thing you want here are just non-essentials. Some people also suggest a magazine or a book. That's okay. For diabetics, I've been told it might be helpful to have a list in here, not only of what medicine you're taking for your diabetes, but what machines you use for monitoring, and who's following you for your diabetes. Because, gosh, there's so many devices, and particularly if you have an implanted insulin pump or a continuous glucose monitoring device, you're going to want to have a list somewhere that's attached to your arm. Usually you're going to want to have a list somewhere of what you have going inside your body or monitoring your body. Okay. So in terms of the non-essentials, you just want to have just a few things like that. A book, maybe a magazine, possible snacks, change for just in case. All right. So that's my to-go bag. It can just sit in a closet. Well, of course, I'll have to fish my phone out here, but that's it. And I think it's just important, if we're going to really talk about planning and being prepared for any circumstance as best we can, I think a to-go bag is a really good idea. And I do run into a lot of people who want to create that for themselves, people who live with other family members. I run into many people who are aging in place as solo agers that want to have it for themselves, because who else will be with them to remember to do that? So if you're the one calling 911 and you're alone and you've got your to-go bag ready to go, the only thing you have to drop in there is your phone and maybe the plug and the charger for your phone. That's it. Simple, simple. So I hope this has been helpful for you. I like to do this every few years, every couple years, maybe every 18 months, because I run into it. And recently I have had some trips to the emergency room with some of my clients, and the last thing I grabbed was the client's phone and phone charger. It's that important. All righty. If you have any questions or comments, you can call us at 866-466-9734, or you can go to our website, which is fourseasonscare.org. And feel free to go there to request a copy of this list, and I'll be glad to email it to you. No charge. I just want to make sure everybody's prepared, because we all deserve to receive the right care at the right time. And if we can be of any further service to you in any of our service lines, just call us or email us. It'll be a privilege to be of service. So join me next Monday, February the 4th at 12 noon for another topic with Ask a Care Navigator, Mondays with Maureen. Thank you, everyone. We appreciate your interest.